Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right aid for evaluation of the wisdom tooth and the inferior alveolar nerve. Now moving to the sagittal segment. This is the sagittal segment. As you can see, this is a mesioangular impaction. We've got a grossly carious tooth which has a carious lesion here. And then this is where you can very clearly see that the apex of the inferior alveolar, apex of the lower right wisdom tooth comes in very grave contact with the inferior alveolar nerve. There is very slight compression, but and there is no looping of the roots around the inferior alveolar nerve, but there is definitely contact between the tip apex of the wisdom tooth and the inferior alveolar nerve. Now we're going to move from sagittal to axial view. The axial view is basically the top to bottom view. Here you can even see better. You've got the horizontal impaction. You can see the cavity, and here you can see that the apex comes in close contact to the inferior alveolar nerve. Here again, and here again. So you can very clearly see at each point that the inferior alveolar nerve is very much in contact with the apex of the wisdom tooth. Now moving to the coronal view. So here you can see the crown portion. Here you can see the inferior alveolar nerve ascending, and here you can very clearly see that the apex of the wisdom tooth right there is compressing the inferior alveolar nerve. There we go. If you have any further questions, please feel free to reach to our team. Thank you very much.